This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Well, we all know a cancer diagnosis is devastating. It's even more heartbreaking when a child is diagnosed.
But just last year, nearly 12,000 children under the age of 15 were diagnosed with cancer. Most of these kids just hope for a cure. Don't think of much of anything else.
But many children and their parents are now considering fertility options before they undergo cancer treatments.
It sounds really good right now. Starbucks.
Today, Christina Montana is just like any 16-year-old, but 2 years ago, she got some devastating news.
He just straight out told me, you have something called lymphoma.
Christina had chemo, radiation, and a bone marrow transplant. But first, she had to think about something most girls her age never even consider, her fertility.
It's like one of those, well, I might want babies in the future.
Many of the cancer treatments that we give, while life-saving, is also toxic to the finite number of eggs that each person has.
Dr. Irene Sue says there are options for preserving fertility. For girls who've reached puberty, it's freezing eggs or embryos. For younger patients, it's freezing ovarian tissue.
We've had really as young as 3 or 4 that their parents want to talk about what is the likelihood that their kids will be able to become biologic parents later.
About 80% of kids with cancer survive, but only 30 to 40% receive counseling on fertility options when they're diagnosed, and fewer than 10% undergo a fertility preservation procedure. Christina decided to freeze her eggs, but her doctor never mentioned the option. She's now trying to pass a law that requires physicians to tell young patients about fertility procedures.
And not finding out till they just can't anymore just doesn't seem fair at all.
Today, Christina is cancer-free and looking forward to the future. And maybe one day that will include being a mom. And Dr. Sue says finances are a very big issue for young patients. More than half of the patients she sees cannot afford the fertility preserving procedures. Programs like Fertile Hope and Heartbeat often provide financial assistance and free fertility medications.
Well, there is another way that cancer patients are finding hope, and that's with experimental treatments. Those treatments are given through clinical trials.
Now, many people associate clinical trials with big universities and big cities, but patients on Delmarva can participate without leaving the peninsula. And here to tell us more is Dr. Thomas DeMarco, Medical Director of the Richard A. Henson Cancer Institute at PRMC. Welcome back, Dr. Marco.
Thank you for having us.
And let's just start off with, for those who don't know, we hear about them all the time. What are clinical trials?
Okay, a clinical trial is basically a research protocol where a patient or a group of patients are selected and various treatments or devices or strategies are implemented to see which is the best for the patient.
Right. And usually done outside a university?
Yes, it usually is.
So why are these so important?
Well, this is really the only way that we can prove whether or not a new therapy or a new strategy or a new device is effective. Or we can prove one isn't effective or is dangerous for the patient or advantageous. So this is really the only way. Once a drug is improved, and approved by the FDA, there's still a lot of questions about the drug itself. So this is where we actually take patients and put it in the, so to speak, the trenches and really test it to see what is really good for the patient.
When a patient gets involved in a clinical trial, how long does it usually last?
Clinical trials vary. They could be 6 months or they could be 10 years. They go across the entire spectrum.
And PRMC can participate. How did that happen?
Correct. Well, we've had clinical trials for quite some time, but in 2011, we became a partner with Johns Hopkins Clinical Research Network, which opened up a lot more clinical trials for our patients here. And what this does basically is give us the access to a university-type clinical trial, but our patients here can participate and they don't have to go there. We can do all that right here in town.
And that's one of the benefits. I'm sure there are other benefits to doing a clinical trial. What are they?
There are several benefits, and the first thing is it really gives the patient better care than he would get if he was not on a clinical trial. They have access to therapeutic modalities that normally he wouldn't have. There might be a new drug that he wouldn't be able to have, or a new medication, or a new combination of medications which we use frequently. Also, there might be a new device, for instance, that we might use, implants, things like that you wouldn't have an access to if you weren't in a clinical trial. And I think also patients that have very complicated problems, especially in cancer, where you're in a phase 1 or a phase 2 or a really kind of advanced disease process, and we're not sure what the best treatment is. This is a great way to go back and find it, not only for the patient who's involved in a clinical trial, but all the people who come afterwards that benefit from that knowledge.
Well, it sounds like you might need quite a few. How do you find enough patients to participate?
Well, that's one of the reasons I'm here today, because we want to educate the community and also physicians around here also that it's a great advantage for patients. And I think nationally, if we look, there are about 3 to 5% of all the cancer patients in this country are involved in clinical trials. And our percent that we have at PRMC is around 4%, which is actually quite good. But we'd like to keep that level up, if not get better at that. So we really need to select as many patients as we can, and all patients are potential candidates.
Right. Is there a criteria they have to meet?
Right. Well, what happens is we have a group of research nurses that actually pore over all the different patient data that we have to see and pick patients out that might qualify for these clinical trials. That said, it doesn't mean everyone will qualify, because these clinical trials are very particular and they're very structured. So a little tiny deviation from what would be accepted by the trial might eliminate the patient. But we do a pretty good job of really trying to get a good screening population of patients from which we can pick good candidates.
Well, I'm just a little selfish here. Is it safe?
Right. Well, we have what we call a dedicated review board that is a separate body of people who are totally uninvolved in the study at all. And their primary concern is the patient's safety and the patient's privacy. It's a very, very big topic. And the boards review the studies beforehand, during the study, and afterwards to make sure that the patient's safety is foremost and their privacy is foremost. So those are the two things that we really look for.
Right. And you know, when you think of clinical trials, you think of maybe you have to take some kind of medicine, you have to ingest something. That's not always the case, is it?
Not always the case. And as a matter of fact, sometimes we'll have a trial where patients will not be given a medication to see whether or not that's better than certain other medications. Or they will get a combination of drugs or a combination of procedures, whether it's radiation, whether it's chemotherapy, or even some non-chemotherapy medications, which we have now called targeted therapies.
So now, clinical trials, they're free, right? The patient doesn't have to pay for that.
They are generally free. However, honestly, every now and then we do run into a problem, because some clinical trials do require that the patient have certain extra testing. For instance, a CAT scan or some extra laboratory studies. And every now and then we'll have a problem with insurance companies not funding that because it's a clinical trial. However, there are a lot of research grants, and we do everything we can in our power to make sure that we can fill those gaps with some of that grant money that we have.
Gotcha. Dr. DeMarco, thank you so much for some wonderful information this afternoon.
Absolutely. And if you'd like to get more information from PRMC about these clinical trials, go to delmarvalife.com and click on the Show tab. Well, our pets' health is also important. We'll find out what you should be doing for them each and every day and why it can have a big impact on your pet's overall health.
Or maybe you're looking for a pet. A little bit later on, we're going to connect you with several cats and dogs in Delmarva that need a loving home. But first, we just learned about cancer trials. Dr. Oz has more on the importance of screening when it comes to breast cancer.
Hi, I'm Dr. Oz. When breast cancer is detected early, it's often easier to treat. Screenings can help you find cancer before you notice symptoms. Mammograms are the most effective kind of screening, according to the CDC. So if you're 40 to 49, talk to your doc about when to get mammograms. If you're 50 to 74 years old, get them every 2 years.